Medical experts suggest that we all wear a mask when we head out to prevent the spread of COVID-19. But in this hot summer heat, many people are finding that those masks are also taking a toll on our skin. So what are the best ways to take care of our skin under that mask? Well, that's where we bring in Dr. Stephen Hess. He's the dermatologist and medical director at Center City Dermatology. So good morning to you, and thanks for joining us.
Well, good morning. Thank you. I'm glad to be here.
Well, you know, we were talking during the break. I told you that I'm actually having an issue with this maskne, getting some pimples all on the cheeks. This is a common problem that you've noticed. Talk about some other problems that you've seen in the skin that's affected by wearing a mask, and actually what is causing all of this?
Right. Well, we are seeing a lot of issues with patients developing maskne or other rashes under the mask. Since the COVID-19 pandemic. So maskne is one thing where patients will develop pimples like acne on the chin, the cheeks, and sometimes even the upper lip. But there are several other conditions that can also flare under a mask, such as rosacea, seborrheic dermatitis, a condition called perioral dermatitis, and also irritant contact dermatitis. So there are a number of skin conditions that we're seeing that can occur in this area, and they're related to wearing the mask. And we think that these are caused by the heat, the friction, under the mask, as well as sweating and the buildup of dirt and oil in this area. And it does seem to It does seem to occur more frequently in people who wear masks for long periods of time, and those that might wear the thicker, more occlusive masks, such as the N95 masks. And we're seeing a lot of this in healthcare workers, for example.
And you're telling us that there are things that we can do to actually help our skin to get it healthier. And we do have a couple of those tips. We're going to put the tips up on your screen. So the first tip is to actually take care of your mask. Talk to us about that.
Sure, absolutely. Well, one thing is if you wear a surgical mask like this person's wearing, you want to change that mask after wearing it a few times. You don't want to wear the same mask for many days in a row. If you're wearing one of those cotton masks, that may actually breathe a little bit better and be a little better for your skin. And those masks are washable, and you should wash them frequently.
The next tip that you have is to avoid wearing makeup and other products on your skin underneath the mask. I'm very guilty of that.
Yes, that's really important, because whatever you put on under that mask is really going to be occluded by the mask, and that's really going to get into the pores there and can clog the pores. So I generally tell my patients to avoid wearing things like makeup and other skincare products, even sunscreen under the mask. That can just cause a lot of problems. But what you should do is wear a mild fragrance-free moisturizer under that mask, because that can actually protect the skin from friction and irritation, as well as the buildup of dirt, sweat, and oil.
Good tip right there. The next tip is to make sure that you wash your face.
Absolutely. You should certainly wash your face when you take your mask off with a gentle, mild cleanser. Now, you shouldn't wash your face more than, say, 3 times a day, because if you do that, you can actually dry out your skin. That can kind of trick your body into producing more oil, and then you can end up getting more acne from that. But you should use a gentle cleanser to wash your face after removing the mask.
And there's been a big debate. I've heard a lot of people say that you need to use an oil-free kind of wash to get a lot of that dirt off, and then other people are saying, well, the oil causes your pores to clog. What is the response to that?
Well, I would say that you should use a gentle oil-free cleanser. Your body does need to produce some oil to protect the skin, but if you over-dry and over-wash the skin, your body, as I said, will produce more oil, and that can clog your pores and lead to worsening of acne. So there's a balance. You want to wash your face twice a day, maybe 3 times a day, not more than that, and I would recommend using a gentle cleanser.
I love it. And the last tip that you have is to use caution with those traditional acne products.
Absolutely. So the area on the cheeks, chin, and jawline tends to be an area that is prone to irritation. So traditional acne products such as salicylic acid, benzoyl peroxide, and even retinols can really irritate the skin in this area. And as I mentioned, sometimes people can have other skin conditions aside from true acne under their mask that these products could irritate. So what I would recommend is, if you're developing a rash of any type under your mask, bumps, redness, pimples, If that is not clearing up with the simple tips we mentioned, you really need to see a board-certified dermatologist who can make the correct diagnosis and help to come up with a treatment regimen that's both effective and tolerable for the delicate skin in this area.
All right, Dr. Hess, thank you for coming on and sharing those tips with us. How can people get in contact with you?
So they can reach us at my website, www.centercitydermatology.com, and we're also on Instagram at Center City Dermatology.
Awesome. Well, thank you so much for coming on.
Thank you. Happy Friday.
Same to you.